Well, hi there, everybody. My name is Dr. Jeff Schroder, and I'm going to be your instructor for your next class, which starts this week, and that is NU601, Principles of Healthcare Research. I've started doing these video introductions about 6 months ago, and I find that they're very useful because they do a few things. And one, if just in an overarching way, allows me to think a little bit of a better connection to the class than if I'm just posting a written introduction. The feedback that I've had from students is that they really like the video introduction, and it feels like they're working with more of a real professor or a real instructor behind the screen, and that there's somebody real that is really invested in what you're learning. And so I hope that I convey that. That's really my main desire here. Also, it allows me to discuss any of the concepts which seems like they may be difficult to understand or unclear. And that's especially important for a class like this. In week one of this class, we're going to be discussing the differences between qualitative and quantitative research. And if you don't have a lot of introduction to research, these terms may seem a little bit difficult, even though they're a little bit easy to grasp. Essentially, quantitative research, when I mention quantitative or research from the positivist philosophy, that's what you more would think of when you think of traditional research, where you have dependent and independent variables, and as researcher wants to see how one intervention or variable affects another intervention or variable, and you have as many controls on this experiment as possible. And those are very important types of research that we do in nursing research, because they allow us to show that there's a true correlation between two things. That we can say that, for example, the number of nurses working on a unit has a direct correlation, and we can really support that the more nurses we have, the better quality of nursing care that we have, or the higher customer satisfaction, the lower length of stays, the lower infection rates, or what have you. And that's very important. But there's another type of research as well, and that is what is known as qualitative research that follows the naturalist paradigm. Qualitative research is actually really the bulk of nursing research. Most of the research that is happening in the nursing world today is qualitative in nature. And qualitative isn't so much where you're trying to prove anything. You're not trying to show that there's a correlation between two particular variables, or to show that one thing will cause another. But rather, the analogy that I use is the qualitative research is more like a documentary, where a researcher goes in with a very broad question. For example, what is the lived experience of women going through labor, and how they interpret the medical system and the nursing care they receive? Or what is the values and attitudes of nurses working in large teaching hospitals versus those working in small rural hospitals? And the idea isn't that we're trying to prove anything. We're not trying to show that, one hospital or one group of patients or one kind of care is any better than another, but just what do people think about it? What is the qualitative nature? It's all very subjective. Quantitative is very objective. That's the whole point of quantitative research, is you're measuring things in an objective nature. Qualitative is very subjective, and isn't really meant to show judgment. It's just meant to identify and record what do people think, what do people feel. And so in that way it is useful, because it is important to understand those things, but we can't use it to prove two things. We can't have two people sharing two opinions and say one trumps the other, or one's necessarily more valid or more important than the other. So that's the limitation. And that's what the focus of this first week of class is going to be. You're going to be in the discussion question, going to be reading two different articles. One is going to be written from a quantitative perspective, where it's actually going to measure a particular effect of a nursing intervention. And the one is going to be one that is going to be a qualitative in nature, where it's just trying to review and trying to see what the lived experience of a particular kind of a patient is. And so there's two articles that you will find, and you're going to discuss how one is very quantitative and deductive, and the other is is more inductive. And those are the terms we're going to be discussing this week: inductive versus deductive logic, and this qualitative versus quantitative. And this is going to give us a very broad overview that we're going to use as we jump off into the following week. So for this week, please go ahead and review the syllabus. We have the one discussion question due this week. And in the coming weeks, I'll be describing each of the week's assignments, the things that you need to keep on your radar screen, such as it is. But for right now, rather than just discuss a lot of things or describe a lot of things here in the syllabus. The syllabus is fairly self-explanatory, and as you have any questions, please feel free to post them in the Ask the Instructor forum. That's the best way to post anything for me. That's the best way to get questions to me. I am in the class virtually every day. There may be a time when I'm out of the class for more than a day or so. If I'm going to be out of the class for more than a day, I will always let the class know, give you an alternative way of getting a hold of me, but I should be pretty accessible to you. My email and my contact information is posted within the class. Again, if you have a question that you think pertains to the entire class or that other people may have, please post it in the forum. If it's one that's of more of a personal nature or a issue that you have specifically, send it to me via email. If all else fails and if you need to get a hold of me immediately for some reason, which doesn't usually happen, but my cell phone number is included as well, so you can go ahead and reach me there. I am available for phone consultation. I like to do video consults as well. I have a variety of different tools that we can use to discuss video in a video meeting if you would like. But I don't actually have specific office hours. You just need to contact me and we can arrange a time when it is best to talk, best to meet via video, or whatever really works best. My goal as an instructor is to try to make this a really useful and a good class for you. I loathe busy work. I promise none of the work that we do in this course is going to be busy work at all. Review the rubrics. Review the rubrics, especially for the discussion questions. The discussion question rubric has been clarified a little bit this last couple of classes. You are expected to be in class on multiple times each day. In other words, your discussion questions will always be due on Wednesday, with your follow-up discussions due by Saturday night. However, you're expected to be in class on more than just a Wednesday and a Saturday. In other words, I want to really foster having an ongoing discussion. The minimum number of discussion questions is posting one initial response and then two follow-up responses to peers. You need to get more than that, or need to post more than that or exceed that in order to get full credit for a week's discussion questions. Also, posting on different days of the week, not just all on one day of the week, is required for full credit. And I'll be giving you that feedback as we grade discussions, but I just wanted to say that at the outset that I really want to foster an ongoing discussion. So plan on being in class a minimum of 3 days each week, one day where you're going to come in and post your initial response to the discussion question, and then on 2 other days where you're going to be giving feedback to either myself and the questions that I pose, or to your fellow students. These introduction videos typically last less than 10 minutes, somewhere between 8 and 10 minutes usually, sometimes much shorter than that, and occasionally a little bit longer. So just realize I don't like to waste anybody's time with these videos, but it does help, I think, to have the videos available. But when you see them, they're usually going to be somewhere in that 8 to 10 minute range. So I look forward to working with you, forward to being with you in class. As you have any questions, please feel free to go ahead and send them to me. And we'll see you in class, and you'll see me in video next week.